committed to building a brighter future for New Zealand. We are on track to achieve this. Thank you, Mr. Chair.
Mr. Chair.
I call the Honourable Minister Tony Ryle.
Mr. Chair, nothing is more important to New Zealanders than their health. And that is why this government works every day with a huge number of very smart people in the New Zealand Public Health Service to deliver better services for New Zealanders in these resource-constrained times. All around the world, health services are retrenching, they're cutting the services they offer their people, they are cutting the numbers of staff, they are cutting the offering they have to the public. But here in New Zealand, under the leadership of both the Prime Minister and a Finance Minister strongly committed to the New Zealand Public Health Service, we continue to invest strongly. We continue to invest in priority interventions that will not only improve the health of individuals, but also moves to improve the health of the populations within a framework of a need to get greater value. I want to thank particularly the Chairman of the Health Select Committee, Dr. Paul Hutchison, who was, before he came to Parliament, one of New Zealand's leading obstetricians, gynaecologists, for the work that he did. He does as Chairman of the Health Select Committee. Thank you for the very strong interest he particularly has in maternity and child health policy here in New Zealand. I think Dr. Hutchison's very strong focus on the importance of immunisation has to be recognised, but also I think the very strong advice he's given to the Parliament over a number of years about the need to invest in maternal and newborn health. And I thank him for working with the government for the very significant announcements that will be made in the next few months about another very significant investment coming in the area of maternal and newborn health, and thank you for the contribution that he makes there. The government's very focused on improving child health in New Zealand. Not only have we looked at lifting and worked hard to lift the immunisation rate, going from 70% when we started to 93% today. In fact, in the richest families and the poorest families have the best immunisation rates of 94% of their 2-year-olds at the moment. We've also invested very heavily in rheumatic fever, as Dr. Hutchison said, a third world disease that has incredible impact on Maori and Pacific families in particular. It's actually been a national health strategy since 2001, when Annette King announced it would be one of the government's health strategies. Well, basically they did nothing. So we put 12 million in last year, another 12 million this year. Huge tens of thousands of kids will be regularly throat swabbed in order to try and really stamp out this rheumatic fever over a period of time. But we've also done this government has created a turning point in the fight against tobacco. We've created a turning point in the fight against tobacco, and information in the next couple of months when it's released will show that this government in a 4-year period has delivered the most sustained reduction in smoking rates of any country in such a period. And that information will indicate what happens when you have a focus not only on these sort of punitive measures that we might have seen elsewhere, but also on the need to encourage people to change their lifestyle and their addiction to tobacco. And that's the huge effort the government has done to roll out brief intervention conversations between smokers and health professionals, not only in our hospitals but also in general practice. It is one of the most effective interventions to reduce smoking, is to have those sort of conversations, but of course the most effective, as Professor Blakely from the University of Otago said in the room opposite last night, is increasing tobacco excise tax.
I'm sorry to interrupt the Honourable Minister. The time, Honourable Members, has come for me to report progress.
The House is resumed. Mr. Chairman.
Mr. Speaker, the committee has considered the Appropriation 2012-2013 Estimates Bill and reports progress. Mr. Speaker, I move that the report be adopted.
The question is that the report be adopted. Those of that opinion will say aye. Aye. Contrary, no. The ayes have it. This bill is set down for further consideration in committee next sitting day, and the House will stand adjourned until 2 p.m. tomorrow. Good evening.